It can happen in any community, and victims can be any age, race, gender, or nationality. We're talking about human trafficking. Would you know it when you saw it? Joining me today on Newsmakers is Maggie Shade, RISE Coalition Coordinator, to talk about recognizing the signs and prevention of human trafficking. Thanks for joining us, Maggie.
Thanks so much for having me. It's an honor to be here.
You bet. So tell us, what is the RISE Coalition? What does RISE stand for?
RISE stands for Regional Intervention of Sexual Exploitation. And RISE exists, we truly are a coalition. We're not our own organization doing our own thing. We really want to bring everybody to the table. We think it is a community effort. We think it takes everyone to fight human trafficking. And so we want to have people from the medical field, from education, from the business community, from law enforcement, faith community, everybody here to fight human trafficking together. So we focus on two main areas, training and awareness, because we think, if people don't know what to look for, they're never going to see it, because we know it's happening. We just need to know where it is and what to look for. And then also victim services. So whenever we identify a case of human trafficking, whether that is our coalition sees that, or law enforcement lets us know, or the medical community, whoever that is, then we have a victims response team that can go in and meet with that victim, find out what services they need and things like that. So those are our two main areas of emphasis.
That's a big job.
It is, it is.
And so tell us, what is the basic definition of human trafficking?
So human trafficking, specifically sex trafficking, which is most of what we do as RISE Coalition, is to elicit a commercial sex act by the use of force, fraud, or coercion. So the legal definition of human trafficking, those three things are really what we look for. Through force, someone is forced to do that, whether by physical force or mental, whatever that is. Fraud, so telling them something that is not true, or coercion, usually a mental game of coercing them into some type of commercial sex act. And so a lot of people hear commercial sex act and they think, okay, it has to be money. It has to be actual money. But really, it's just anything of value. So it could be a sex act for housing or for food for their kids or things like that. And so that's where it gets kind of tricky. But that's the basic definition. That's the legal definition, but also what we go off.
Okay. And so what are some of the signs of a trafficking victim? Because no two are alike.
Exactly. We try to look at it as these are pieces to a puzzle. So you're so right that one trafficking victim is not going to look the exact same as the next one. And just because someone has one red flag indicator doesn't mean they're automatically a trafficking victim. But so we look at it as these are lots of different pieces to the puzzle. And when you start to see a few of those, you think there's something else going on here. There's something that needs to happen. And so a lot of times we see maybe a girl, which it could be a male too. Most of the cases we see are female, so that's why I usually say female. But it could be a girl that is unable to speak for herself. Maybe she's with a guy who won't let her answer questions or won't let her say anything. We'll see sometimes at like a gas station or a casino or something like that, if he is in charge of her documents or her ID, if she's not holding her own ID. And then we also see things where just in schools, like signs of abuse, signs of neglect, signs of just someone who is maybe more withdrawn than they used to be. One thing for parents to really be aware of is if your child is coming home with a lot of new gifts or a lot of new expensive things like jewelry or devices, and you didn't buy that for them and they don't have $300 to spend on that. So again, those are all things that one of those things on its own, it may not mean anything. But if you see a couple of those things and you think something is not right here, that's usually a pretty good indicator that something is going on there.
Because the gift giving is part of the grooming process,
Absolutely.
right?
Yes.
They make them feel like they're worth something and
Absolutely.
nice to them.
Yes, we see that a lot. Grooming is huge, which is why a lot of times victims will say like, I'm not a victim of human trafficking. This is my boyfriend. He's just, lots of boyfriends make their girlfriends do these things, and that's not actually true. And so there is that grooming process where they make them feel really loved, they buy them things, they promise them things, and then they're hooked at that point. And so they will stay with them. They will feel like I'll do anything for him because he'll do anything for me, which is not true.
Right. It's just an illusion.
It is, absolutely. Yeah.
Well, and how would you know, like you were looking at a victim, what signs can you put together and say, or is it a conversation you have to have with that person?
A lot of times, yeah. Sometimes it is just looking at them. It is really hard to tell because traffickers are really good at what they do.
Sure.
And there aren't a lot of cases of girls or victims who, have really obvious signs, or they're good at kind of covering those things up. But if you are in a relationship with somebody, it's kind of hard to have that conversation if you see them at Walmart or if you see them on the street. But if it is somebody that you're in a conversation with, those are questions you can start to ask, like, tell me about this new boyfriend, or tell me about this person you met online. Have you ever met them in person? Those kinds of questions that can really kind of start to dig down deep in that.
Yeah, because you might know that there's somebody, or you might hear about it in the news after the fact, like they broke up a massage parlor, ring,
absolutely,
or girls at a hotel or motel. But if you don't go to those places, you might not spot them or know them.
Right. And that's, one thing that we see a lot, because we have had cases exactly like that. Especially with girls that maybe that happens, there's an operation or something at a hotel that they see. The thing that we really like to think about is that these girls they're going to the store, they're going to gas station. A lot of times they're going to gas stations. That's where they're getting most of their food or things like that, cigarettes. They're going to the doctor. It's crazy, the statistics about the number of people that go see a medical professional while they're being trafficked, because whether that is for some type of STI test or pregnancy, or it's just because they have the flu or they need a COVID test or whatever it is, they get sick too. But the rate of victims that are identified through the medical community are extremely low. And so that's why we've really wanted to step up our game with training medical professionals, and our medical professionals around here have been incredible, have welcomed that training, are doing all of those things, because we know that people, everyday community people, are going to interact with victims of trafficking. And so that's why training is such a huge part for us, that we want people to know, like, these are the things to look for. If you overhear this kind of conversation, or as a medical professional, is there a way that that you can set it up to where maybe you can get that victim away from the person they came in with, so that you can have a plan to kind of be able to ask those questions or know what's going on in that situation.
Yeah, and I know a lot of real life mimics what you see on TV, but sometimes it's the opposite. They make these shows because this is happening. And I remember an episode of Grey's Anatomy where there was a victim, and only one of the doctors knew it in his gut. And it was just a questioning. But it wasn't discovered till after the fact.
Knowing what questions to ask, knowing what things to look for, even how to ask a question, because again, most of the victims that we see that are in the life that are being trafficked would not say that they are being trafficked, whether that's because they're in denial and they don't want to admit it, or they really truly do not feel like they are being trafficked, even though we know by definition they are. And so really being aware of those things and being able to spot those, like you brought up movies and TV and stuff, and there are cases of it like that where that is actually how it happens. A lot of times we kind of over sensationalize it when we look at movies like Taken, and we think okay, well, that is a girl chained to a radiator, and I've never seen that, so I've never seen human trafficking. And it's like, if that's all we're focusing on and that's all we're looking at, we are going to miss all of these victims in our community because it's happening in our community. We still have people that say it's not happening here, and we think, if you're just looking at the movie Taken, you don't see that here. You're not going to see that.
They're not going to auction them off down at stockyards.
Exactly. But it is happening here. It just looks a bit different.
And so who is most at risk? I know, we say girls, but there are others. Transgender, mentally disabled. Who are
really, what we like to say is that trafficking is about exploitation of the vulnerable. And so any type of vulnerability will make you more at risk for trafficking. So that is students, young people living in poverty who maybe are trying to, put food on the table, make ends meet for their family, people who are disabled, people who have some type of mental illness. Really what we see a lot of is kids in the foster care system, because especially those teenage years where they're probably going to age out of the system, They don't have a lot of people really like as their safety net kind of thing, which we have an incredible foster care community here. And they are doing training, our agencies are, our foster parents, which is such a beautiful thing to see. But still, there are those students that are kind of falling through the cracks because they don't have, parents that are watching. Yes, absolutely. And so really anyone that has any type of vulnerability, the, LGBTQ community, transgender, things like that make them in some way vulnerable, that maybe make them feel like they don't belong in their community. And so there are traffickers ready to say, come with me, you can belong in this community.
Right.
And it's incredibly dangerous.
And a self-esteem issue
Absolutely.
as well, and which a lot of teenage girls go through.
Yes. And that's what's really interesting that we see is that it is so much of an identity thing, and traffickers know that, especially when it comes to online. They know what to say. They know how girls want to feel. Really, anyone wants to feel. They know how to offer those things, mental and emotional things, not just physical. And so really to kind of step in and be that person that wants them, like those people are wanting to be wanted, when really they're just going to use them. They're going to be a product, not a person to them.
Well, and I was thinking about this in coming up with some of these questions, but a rich girl could be as easily at risk as a poor girl.
Absolutely.
Because she's rich doesn't mean she has that self-esteem or she has that village around her.
It is so true. We have seen socioeconomic levels all across the board where that happens, especially because around here, what we see is a lot of our cases do begin online. And so pretty much every young person has access to a device. They are able to get online and have Instagram, Snapchat, whatever, any of those apps. And so, it really isn't about socioeconomic status. It's about somebody who wants to be wanted, and a lot of people will just take advantage of that. So, yeah,
and the internet, it is a double-edged sword.
Yes,
there's everything that you want to know, knowledge-wise, but there's also the scary dark side of it.
Oh, absolutely. And that's, like I said, where so many of our cases begin. And honestly, the most terrifying thing is how quickly the numbers have doubled since COVID, because kids were at home for so long. Adults were at home for so long. So the demand for things like pornography, stuff like that, really skyrocketed. And it just is heartbreaking that how all of that has increased so significantly. But when I was a kid, it was always like, okay, watch out for the man, the scary man in the white van, like stay away from him. And now that creepy man in the white van is online, and he is posing as an 18-year-old girl or a 20-year-old boy, and he is, it's not as evident that that's who it is. And so that's what's really terrifying, is that so much of it starts online. And I have a 2-year-old and a 6-year-old at home, and so all of this talk just terrifies me, because I know that it's coming and it's only going to get worse. But there really are so many ways that we as parents, or even just we as caring adults with kids in our lives, can help them to know how to avoid those things online and to be wise with that. But so much of it does begin online, which is so scary.
Well, and talk about that, the cyber grooming. When is a good age to talk to your kids about it? Obviously you can't talk, sex education to a 5-year-old, but how do you make sure that these kids, and at what age, understand you can't take sexually explicit pictures of yourself? Somebody, there's identifying characteristics. How do you teach that? When do you start that conversation?
Honestly, it really it backs up all the way to teaching really young kids about, obviously I have a 2-year-old. I'm not going to teach my 2-year-old daughter, here's what a trafficker is, here's what a pimp is, things like that. She doesn't need to know that. But teaching her about body safety and consent, and who proper terms for your body, and who can touch your body, who can see your body, and the point of all of that. And even with giving her a bath, to be really verbal about those things and what's happening. It starts as young as that, and then as they get older, to prepare them for other things. It's crazy. I think it's between 7 and 8 is the average age that a person sees a pornographic image for the first time. I think it actually might be as young as 6. I can't remember. It's somewhere between 6 and 8. And so even then is teaching our kids what to do if you're on the bus, if you're at school, if you are at a neighbor's house and they show you something like this, then what should you do? And there's a way to do that, an appropriate way to do that for a 6-year-old. But then it starts to get especially as kids get their own devices, that's really where the conversation begins. And really for us as parents, us as caring adults, to just really love those kids enough to set healthy boundaries, to help them be responsible, to learn those things. So to say, not everybody you meet on the internet is telling the truth, you know? I have asked some of our law enforcement guys, especially that are with the Internet Crimes Against Children unit, like, okay, you are parents, tell me your rules. You know it all, you see it all, you tell me what to do. And they have really great rules. Like there are no phones in bathrooms or bedrooms. Phones stay in the living room and kitchen, and that's it. And even things like that for a 12-year-old, 13-year-old that has their own device, like that alone, and to be able to say this is why, because their brains are not fully developed. They're not going to make great choices. You know, we always say, I would never, as a parent, if I'm looking at the Arrowhead Stadium and it is full of sex predators, like I would never in a million years send my child in there unattended. Never. Nobody would do that. But when we hand our child a device and we don't monitor it, we don't help them know how to handle it, that's basically what we're doing. Because again, like you said, the internet can be so great. It can also be so terrible. And so we really have to love our kids enough to set healthy boundaries, to help have guidelines, to help them understand what's going on. So, and there are age-appropriate ways to do that all along the line that really set them up for that win. Because you can't, you can't start that conversation with a 15-year-old.
Right.
You know,
it's too late.
Absolutely, yeah.
Well, and it's hard to put the genie back in the bottle.
It
is. When you get a 3 and a 5-year-old who are used to watching like a tablet.
Yes.
Watching YouTube, kids YouTube. Like my grandkids. We had the rule, no grown-up YouTube. Yes. Only kids YouTube.
Yes.
But, as we've gone along and I've watched some of the videos, it's like, that's on kids' YouTube? What?
I know. And the thing about stuff like that is that even when you feel like you're in control of it, you're not totally, because it will automatically go to another video. There's suggested videos on the side. And so we have to be able to monitor that. I always say, like, my kids will never have access at this age. They will not have access to a device unless I am right there. Because I don't know what is going to happen. And kids are smart. Kids these days, all they know is technology. They are picking it up so quickly. So really monitoring that and being in control of that, and knowing, like, that's not their device. They don't own that. I bought that. I managed that.
It's registered in my name.
Yes,
exactly.
Absolutely.
Well, so what are some of the latest statistics on human trafficking in our area and nationally?
Yes. So in 2021, our team assisted with 43 cases of human trafficking. So that's 43 victims that we responded to in 2021, which is not quite one a week, but is close. And again, those are only the ones that either self-disclosed, which were very few, or that someone identified, like law enforcement, medical, somebody like that, that called us in to respond to those. And so obviously there are so many more going on. There's so much more happening online that we never take part in, that law enforcement just handles that. And so that is a kind of a shocking statistic for me, is that is the ones that our team responded to.
That gives me cold chills.
I know,
I honestly,
right?
To know that many people in our area.
Yes, it does, and it is something that is happening just more and more. And like I said, the number of online reports that ICAC worked in Missouri doubled in 2020 because of COVID. And so just to know those numbers, that those statistics were so drastically increasing because of COVID. And again, that's another, you can't put the genie back in the bottle. I mean, that is there, and that is not going away. And so those are really the most mind-blowing ones to me, to know that is in our community, because so many people think, like, well, this is America, this is the heartland, this is Joplin, Missouri. those are just from our community. That's not St. Louis. That's not Kansas City. That's not Chicago or New York. That is here in Joplin. That we're responding to that many. Yeah. And we, a lot of times at the very beginning when we started the Rise Coalition, we weren't responding to any. And so for a long time, people were like, see, it's not happening here. And we were like, people just don't know what to look for. They don't know that it's there. And so those numbers continue to grow. And I think it is because human trafficking is increasing, but I think it's also a good sign in that people know what to look for and that it's not just happening secretly, but we're able to see what that is and respond to that.
Well, and talk about what Rise Coalition does with your partners. Like, who are your partners and what is the training process?
Yes, absolutely. So with the medical community, we work with Freeman and Mercy. We do training with their SANE department, with their nurses, all kinds of people in their community, in those places of employment, so that they all know what this looks like, what is going on, what to do about it. We work with all local law enforcement. So that is at the county level, at the city level, state, federal, all of those, because it is such a partnership and because jurisdiction can kind of be a little bit of a nightmare, especially with online cases. And so we have a great partnership with all of law enforcement. We are so, so blessed by that. I think that is what sets us apart from other communities. And I know that because other communities call us in to come and train some of their law enforcement, some of their social services, just to know what that looks like. So our law enforcement has been absolutely incredible. We work a lot with Choices Medical Clinic. They're a sexual health clinic, and so that's really important. They have a mobile unit that's great. So if we do any kind of operation or something like that, we can take that clinic, that mobile unit, which is just a clinic on wheels, that we can do STI screenings, all kinds of things like that. We work with social services. We work with legal aid, with different social service organizations that provide benefits, cross lines, any kind of organization like that. We also work with the faith community, lots of different churches that are involved, that say, I've got this kind of resource or have this kind of thing. Even, just everyday community members. So we have a hairstylist who has been really great with whenever we get a girl that
so smart.
Yes, right. That she, maybe she needs a new look because she's going to kind of be in hiding, or maybe she just needs to feel better about herself, to make a decision for herself. So she can do that. We had a girl one time that went to see her, and she said she was trafficked her whole life, and that cutting her hair was the first decision she ever made for herself.
Oh my gosh.
And so for her to be able to get that haircut, and she sat in her chair for an hour and just got to talk to her and have that, healthy interaction with somebody that was safe. Another one we have is a tattoo artist in town who a lot of trafficking victims have branding tattoos from their traffickers. And that's permanent. That's a mark that you cannot get rid of. And so what she does is, instead of going through the really lengthy and painful process of removing a tattoo, she works with the victim to redesign that into something beautiful and creates these beautiful tattoos. Isn't that so cool? It really is just people saying, this is what I can do. This is what I have to offer. How can I use that? We have pilots in town that are really great about if we have a victim that needs to get back to family or needs to get to a long-term facility or something like that, that we can call them and say, hey, are you available? We need to get to North Carolina. And they'll say, okay, meet me at the airport in an hour and we'll have Wheels Up. And just incredible things. Really, our community is just absolutely incredible. Just the number of people that are willing to help. And so to be able to know what things to look for and how to identify that, and then not just that, but to know what to do when you spot that.
Who do you call? You can call 911, especially if it's an emergency.
Right, exactly.
But if you call, is there a local number, which I think we're going to put those numbers up.
Yes, that would be great.
There's a national hotline, and then your number.
Yeah,
so what should
that's
people
a great question. It kind of depends on the situation. Like you said, if it's an emergency situation, if you see a guy grab a girl and throw her in a car, if you see somebody beat up somebody and you think this is not right, call 911. Definitely do that. If you see a case that you're like, I don't know, this doesn't feel right.
Is it just my imagination?
Yes, and our law enforcement is so great. They say all the time, make the call. If you see something, say something. We would rather you call and be wrong then you miss the opportunity and you be right, and we can't do anything about it.
It's too late.
So you can also always call local law enforcement, the non-emergency line. If it's not an emergency, you can always call Rise Coalition. Always let us know about things like that. What we do ask is, people always ask the question, should I call local law enforcement or should I call the national hotline? And we say call both. If it comes straight to us, a lot of times those referrals come from law enforcement to us, but if it comes straight to us from the text line, we'll decide, do we need to get law enforcement involved here? Probably so, for safety reasons. And then we can send out a victims response team member to go meet them wherever they are. We have these bags, and anytime we respond to a call, our victims response team, we always take a go bag, because it just has lots of items that they would need. So it has a blanket, especially whether, even if it's in the middle of summer,
Right.
you have that shock factor, and a lot of times they're shivering, they're cold. You might be at the police station or the hospital. You just want something comfy that's cozy that can just make you feel
Wrap
a little
you
bit better.
comfort- right.
Absolutely.
Security.
Yeah, a hat is helpful. Sometimes, especially when we did the operations on the Asian massage parlors, we wanted to make sure that whenever they were coming out, we were protecting their identity, their faces. There were a lot of people around. So we do some clothing, some socks, we just do like some yoga pants, a t-shirt, a sweatshirt, because we don't know. I mean, sometimes they're in working clothes, sometimes they're in not many clothes at all. And so we want to make sure that they feel comfortable, that they feel safe. We only put new clothes in there. We don't put used clothes. We want to, make sure they feel good about that. We have these little things that have, it's got a mask in there, it's got a granola bar, some water bottles. These are little things we can take in if we don't need to take the whole go bag.
Like the necessities.
Yes. But we've also got water, some snacks in here, our chapsticks, which I'll talk about in just a second. Don't let me forget about that. Some toiletries, things like that. We always try to make sure we do not have toiletries from hotels, because a lot of trafficking happens in hotels and it can be pretty triggering for some girls. And so we want to make sure we don't have that. So just those kind of items in here is what we have. We have all different sizes. We just have a whole supply of these, small, medium, large, so that we can just grab them and go whenever we need to respond to that. So,
And talk about
this
that's your fundraising?
chapstick is something that has been really beneficial, that we have given out to a lot of people. We've given it to convenience stores. We've given it to all law enforcement has these. It says Rise and it has the birds, but it says nothing about human trafficking. And it just has our text line. It doesn't even say if you need help, text this. If you need whatever.
That's pretty smart.
It just has that number. So a lot of times our law enforcement or medical can say, hey, I just want you to have this. If you ever need help, text this number. The statistic is that a trafficking victim will probably be offered help 7 times before they actually leave that situation. Same with domestic violence as well. 7 times before they actually leave. And so to be able to say, hey, you might not be ready to go. Because one thing we've heard from survivors is that because people say all the time, like, why didn't you just leave? Like, you have your own car, or you're a grown up, you could leave.
It's a wrong way to frame the conversation.
Yes, it is. But their life is on the line. A lot of things survivors say is, every decision I make is based on what is going to get me the least assaulted.
Sure.
And most
It's
of the
the
time,
devil you know.
yes, staying will get them the least assaulted. Leaving and getting caught will probably end their life.
Sure.
Or somebody they love that they will go after. And so we're able to give this to them and say, hey, it might not be right now. You might not be ready. You might not feel safe enough to leave right now, but you can text this number anytime. And we have had situations where, a year or two after somebody got that, they end up calling that or texting that, and then we're able to give them services. So that way they don't have to memorize a number or anything like that. They can carry that and they can feel good about that. So.
Well, the Rise Coalition does really great work. I appreciate you coming on our show.
Yes, of course. Thank you so much. Again, awareness and training, things like that are really key to us becoming a trafficking resistant community. So we're really thankful for the opportunity.
That's amazing. Great work. I want to thank Maggie Shade with Rise Coalition for taking time to talk about this really awful subject, but it's very important. If you suspect someone is a victim of human trafficking, or even if you need help getting out of a dangerous situation, you can call local law enforcement or the national hotline at 888-373-7888. You can also text the words "be free" or "help" to 233-733. This is Newsmakers on KGCS TV from the Ruth Colpin Studios here at Missouri Southern State University, and I'm Bobby Potroff. We'll see you again soon.